Managing gestational diabetes. This video contains a basic overview of the management of gestational diabetes. For individual advice, it is important to seek advice from your healthcare professional. The management of gestational diabetes is a team effort. Health professionals who may be involved in your care include your doctor, midwife, diabetes educator, and dietitian. You may also be referred to a specialist doctor called an endocrinologist. Managing gestational diabetes involves regular blood glucose monitoring, regular physical activity, healthy eating, and medication if required. Blood glucose monitoring is a useful tool to allow you to know what your blood glucose levels are at different times during the day, how food and exercise affects your blood glucose levels, and allows your doctor to make decisions about your diabetes management. Your doctor and diabetes educator should have explained when you should monitor and what range your blood glucose levels should stay in. We will now look at how to use a blood glucose meter to determine your blood glucose level. To do this, you will need a blood glucose meter. This will read the blood glucose level. A user manual for your blood glucose meter. A blood glucose test strip. This collects the blood sample. These have expiry dates, so check if it is current before you use it. A finger pricking device that holds a disposable lancet. A lancet is a needle that is used to prick your finger. A sharps container to dispose of the lancet. Some hand sanitizer or access to soap and water to wash your hands. There are several makes of meter, but they all work in a similar way and they often come with a finger pricking tool. Ensure you are familiar with how your meter works prior to monitoring. Before you monitor your blood glucose level, wash and dry your hands or clean them with hand sanitizer and allow them to dry. To use this particular meter, we take a test strip out of its packaging and insert it into the meter, barcode end first. The meter is turned on by inserting the test strip. The screen then shows an image of a drop of blood. This means that it is ready to apply blood to the test strip. When pricking your finger with a device, you can use any of your fingers. However, it is good to use the middle, ring or little fingers. Prick the fleshy part of the sides of the fingertip and not the tops or pads, as this may be more uncomfortable. To prick your finger, insert the lancet into the finger pricking device and follow the manufacturer's instructions to load the device and ensure it is set to the right depth. Place the device on the side of your finger, then press the button. You should feel a prick on your finger, which will produce a small drop of blood. Pick up the meter and hold it so the small drop of blood is absorbed by the strip. After approximately 5 seconds, the meter will display the blood glucose reading. Dispose of the strip by wrapping it up in a tissue and removing it from the meter. The finger pricking device can hold the lancet safely until you have a chance to dispose of the lancet in a sharps container. You should always use a new lancet device to prick your finger and dispose of the used lancet in a sharps container. Once you have taken your blood glucose reading, it is a good idea to record it in a diary. You could write the time, date and the result in the diary. The results that you record in your diary can help you and your diabetes team identify levels outside of the target range. This information can be used to help make decisions about your diabetes management. The same basic healthy eating guidelines for pregnancy apply when you have gestational diabetes. However, additional focus on carbohydrate foods will help you to keep blood glucose levels within the target ranges. Enjoying a variety of foods from the core food groups will help to provide the essential vitamins and minerals required during pregnancy and meet increased requirements for iron, iodine, protein and folate. The additional need for supplementation should always be discussed with your healthcare team. The reason why there is a focus on carbohydrate foods is because all carbohydrate foods are converted into glucose within 2 hours of eating. This means that if large servings of carbohydrate foods are eaten at one time, this may cause blood glucose levels to rise above the target range. Carbohydrate includes all foods that are made up of starches and sugars, including natural sugars. These foods include grain foods, starchy vegetables and legumes, fruit, milk-based dairy foods, and sometimes foods such as cakes, biscuits, and ice cream. Carbohydrate foods should never be avoided or restricted to below recommendations, as they provide many essential nutrients and you and your baby rely on carbohydrate foods to provide the energy required to continue growth and development. Women require at least 175 grams of carbohydrate each day during pregnancy, with some women requiring more to meet energy requirements. Spreading nutritious carbohydrate foods over 3 meals and 3 snacks a day can help to avoid large rises in blood glucose levels. This can be achieved by aiming for 2 to 3 carbohydrate serves at main meals and 1 to 2 carbohydrate serves as in-between meal snacks. A carbohydrate serve is a portion size of food that contains approximately 15 grams of carbohydrates. Don't stress, you don't have to remember all of these serving sizes. There are plenty of tools available to help you learn about carbohydrate serves. Just as an introduction, the following portion sizes of carbohydrate foods equal 1 carbohydrate serve: 1 standard slice of bread, half a bread roll, 1/4 cup of raw oats or muesli, 1 medium piece of fruit, 1 small to medium potato, 1/3 cup of cooked pasta or rice, 250 ml of milk, and 100 grams of low-fat yogurt. Aiming for 2 to 3 carbohydrate serves at main meals will help to keep carbohydrate intake consistent each day and avoid large rushes of glucose in the bloodstream. Let's take a look at an example. Enjoying 2 slices of whole grain toast with half a cup of baked beans for breakfast or lunch means you would be having 3 carbohydrate serves. There are some foods we do not count as part of the carbohydrate serves, as they have minimal impact on your blood glucose levels. Carbohydrate foods are also broken down into glucose at different rates. This rate of release is known as the glycemic index, or the GI. Carbohydrates can be categorized as having a low, medium, or high GI. High GI foods will put a quick rush of glucose into your bloodstream, and low GI foods release their glucose more slowly. You do not need to avoid all high GI foods. However, aiming to include 1 low GI food at each mealtime can help to stabilize blood glucose levels and keep you feeling fuller for longer between meals and snacks. Some lower GI foods that you may like to include as part of your meals and snacks include rolled oats and oat-based mueslis, milk, yogurt, legumes such as kidney beans and chickpeas, corn, most fruit, barley, pasta, whole grain crisp bread, noodles, and whole grain, soy and linseed, rye, and sourdough bread and rolls. Food and drinks such as sugar-sweetened soft drinks and cordials, lollies, and some desserts such as regular jelly, pavlova, meringue, and syrups will need to be avoided as they may cause blood glucose levels to go too high. There is a lot to remember when it comes to managing gestational diabetes. However, the following tips will help to get you started. Enjoy 3 meals and 3 snacks, including supper each day. Enjoy high-fiber foods such as whole grain breads, fruit, and vegetables. Incorporate a small serve of protein with your meals such as tuna, hard-boiled egg, lean meat, or chicken. Enjoy healthy fats in moderation, such as olive oil, nuts, avocado, seeds, and margarine spreads. Fill up on non-starchy vegetables at your main meals. And go for a light walk after meals. For more information on healthy eating for pregnancy and carbohydrate foods, resources can be found on the Diabetes SA website. Physical activity is an important part of any healthy pregnancy. For women with gestational diabetes, physical activity can help to manage blood glucose levels as insulin can work more effectively with regular movement. You may find it helpful to include some walking after meals to assist in controlling blood glucose levels. In addition to trying to move around more regularly on a day-to-day basis, aim for 30 minutes of intentional exercise a day. It is important to try to aim for a moderate intensity when exercising, which means you notice a slight increase in your breathing and heart rate. It is beneficial if you aim to do this 5 days a week. If exercising for 30 minutes is not achievable, or if you are new to exercising, you can break up your moderate intensity activity into smaller parts of time. For example, You may aim for 2 lots of 15-minute exercise sessions over the day. This may mean 2 brisk walks around the block. There are many exercises that are safe and enjoyable while you are pregnant, with some great options being swimming, aqua aerobics, pregnancy yoga, tai chi, or an antenatal exercise class. Whatever you decide, always check with your doctor prior to commencing an exercise program. This is especially important if you were not exercising regularly prior to your pregnancy or your diagnosis of gestational diabetes. Managing gestational diabetes predominantly involves healthy eating, focusing on carbohydrate intake, exercise, and blood glucose monitoring. Some women may be advised to take oral medication or insulin injections if blood glucose levels cannot be managed by diet and exercise alone. The women who may eventually need this extra help cannot always be predicted at the time of diagnosis. A woman with gestational diabetes will have more frequent visits scheduled with the healthcare team to monitor her health and her baby's health. Some additional tests you may have include an ultrasound to check on the baby's growth and development, and a CTG or fetal heart rate monitoring, and blood tests. Generally, women with gestational diabetes will have a pregnancy that progresses normally and without complication. Most women are able to have a normal vaginal delivery at full term, but are more likely to have a caesarean section than women without gestational diabetes. Your doctor will discuss a delivery plan with you. If your baby grows too large or there are other concerns, your doctor may advise you to have an induction of labour a week or so earlier than your expected delivery date. During labour, your baby's heartbeat will be monitored closely, as will your blood glucose levels, particularly if you were treated with insulin. In situations where treatment has involved high doses of insulin, an insulin and glucose infusion, also known as a drip, may be required. Within days after delivery of your baby, your blood glucose levels will usually return to normal. Your healthcare team will advise you how often to monitor your blood glucose. After delivery, your baby will be examined and blood glucose levels will be checked. Usually your baby will remain with you. In some situations, for example, if there are problems maintaining the baby's blood glucose levels, your baby may be monitored and cared for in the nursery. Breastfeeding has many beneficial effects for the newborn. Breastfeeding soon after the birth will help to maintain your baby's blood glucose levels. Breast milk contains antibodies, which help protect your baby against particular illnesses, infections, and allergies. An added bonus to the mother is that breastfeeding can assist with weight control. Research has found that women who breastfeed may reduce their risk of developing type 2 diabetes later in life. It is very likely that your blood glucose levels will return to the normal range once your baby has been born. This is because the pregnancy hormones start to fall once the placenta has been delivered. To ensure that you do not have diabetes, it is recommended that you be screened with an oral glucose tolerance test 6 to 12 weeks following the birth of your baby. Because you do have an increased risk of developing diabetes in the future, a member of your healthcare team may have also registered you with the National Gestational Diabetes Register. This means that you and your GP will receive regular screening reminders to help detect diabetes. Early detection and management of diabetes will help to achieve better health outcomes. You will also receive information on how to prevent type 2 diabetes as part of the register. This information is not only important for you, but important for your whole family. Research suggests that living a healthy lifestyle and maintaining your healthiest weight can help to reduce your risk of developing type 2 diabetes or help to delay its onset. Exercising regularly can not only reduce your risk of type 2 diabetes, but can also improve your cardiovascular health and your mental outlook on life. Small increases in daily activity can all add up and make a big difference to your overall health and well-being. Enjoy healthy eating as a family by enjoying a good variety of nutritious foods from the 5 food groups. Enjoy fresh, minimally processed foods every day, and enjoy foods such as biscuits, cakes, chips and takeaway foods on occasion. By involving your children in food preparation and enjoying meals as a family, you are helping to educate your children and encourage healthy lifestyle habits to protect their futures. If you are planning on having another baby, it is advised that you have an oral glucose tolerance test prior to conception to rule out diabetes. This is important as high blood glucose levels during the first 8 weeks of pregnancy can affect your baby's growth and development. If you do become pregnant, have another oral glucose tolerance test at your first booking. If this is normal, have another test at the routine screening time of 24 to 28 weeks. Most women with gestational diabetes generally have healthy pregnancies and healthy babies. Getting adequate treatment makes all the difference, and it is important that you are supported and know what to do to manage diabetes. With good management and a healthy lifestyle, both mother and baby can reduce their risks of type 2 diabetes in the future. Health professionals such as your doctor, a dietitian, a credentialed diabetes educator, or sometimes a diabetes specialist will help you understand what to do and will support you. Family can also be a great support, and it is important that they also understand about gestational diabetes in order to help support you.